Today we are going to talk about symptoms, causes, and types of heart failure. If you want the notes, you can download them for free from the link in my description box. Firstly, let's start with what heart failure is. Heart failure is a condition in which the heart becomes unable to pump blood effectively. Heart failure is not a disease on its own, but rather a combination of signs and symptoms due to your heart becoming unable to pump blood effectively to meet your body's needs anymore. Let's quickly review the anatomy of the heart. Your heart has four chambers called the right atrium, right ventricle, and left atrium, left ventricle. The oxygen-poor blood from your whole body returns to the heart through the big veins called the inferior vena cava and superior vena cava, and they are emptied into the right atrium. And when the tricuspid valve is open, the blood moves into the right ventricle, and the right ventricle, when it becomes full, contracts and pumps blood to the lungs through the pulmonary artery. So the blood gets oxygenated in the lungs and releases carbon dioxide, and then the oxygen-rich blood comes back to the heart through the pulmonary veins, and they empty into the left atrium. The blood moves from left atrium to the left ventricle when the mitral valve is open. And when the left ventricle is filled with blood, it contracts and pumps the blood through the aorta to your whole body. So when the contracting ability of the heart is impaired, then the blood flow to the systemic circulation will be reduced, and then the blood will be congested in your ventricles, and then they will back up in the atriums and then the pulmonary veins and ultimately to the lungs. These symptoms of fluid overload are described as congestive heart failure. So what are the causes that lead to the development of heart failure? A number of cardiac orders can gradually make the heart weak or stiff to pump blood properly, which can lead to heart failure. Coronary heart disease, where the arteries supplying blood to your heart muscles become clogged, which may cause angina or heart attack. Thus, the heart muscles become unable to contract and pump blood properly. Cardiomyopathy, which are the conditions affecting the heart muscle. Congenital heart diseases, which are the birth defects that affect the normal workings of the heart. Arrhythmias, such as atrial fibrillation, are heart rhythm problems, and they can mess with the proper filling and pumping of your heart. Hypertension and valvular diseases such as aortic stenosis, aortic regurgitation, and mitral regurgitation put extra strain on the heart, which in the long term can lead to heart failure. Sometimes obesity, anemia, sepsis, drinking too much alcohol, overactive thyroid, or liver failure can also lead to heart failure. These are often known as high-output heart failure. High-output heart failure occurs when there is unusually high demand for blood in your body, and the heart may be functioning normally, but it cannot pump out enough blood to keep up with the extra need. And it can lead to increased left ventricular diastolic pressure, and it can develop into pulmonary congestion. Coronary heart diseases is the cause for 60 to 75% of heart failure cases, and hypertension is also contributing to nearly 75% of heart failure cases, and if you have both, then the risk is even higher. When your heart cannot pump well enough to meet the demands of your body tissues, your heart and your body triggers a number of compensatory mechanisms. In the earlier stages of heart failure, many people do not even feel symptoms because of the compensation systems. You will only start seeing the symptoms when your body is unable to compensate anymore. The main symptoms of heart failure includes shortness of breath with exertion, which means with physical activity or at rest. Excessive fatigue, which means feeling tired most of the time. Swollen legs and ankles. In the short term, the compensation mechanisms are helpful in restoring cardiac output to its normal levels, but in the long term, they are actually detrimental to the structure and function of the heart, and over time, it enlarges the heart and reduces how well the heart can pump blood and worsen the heart failure. So let's see what the compensation mechanisms are. Three main compensatory mechanisms are sympathetic nervous system activation, renin-angiotensin-aldosterone system activation, and myocardial hypertrophy. First, let's see how sympathetic nervous system is activated. Because of heart failure, there is a fall in blood pressure. The baroreceptors located in the aorta and carotid arteries detect this fall in blood pressure, and they signal the brain and thus activates the sympathetic nervous system. The increased activity in the sympathetic nervous system increases the heart rate and the contractility of the heart. It also causes constrictions of the vessels via the alpha-1 receptor in order to maintain blood pressure when the cardiac output is reduced. The sympathetic nervous system also stimulates the juxtaglomerular cells in the kidney, which releases renin and thus initiates the renin-angiotensin-aldosterone system. The renin-angiotensin-aldosterone system is activated because of reduced blood flow to the kidney. The angiotensin II and the aldosterone enhance sodium and water retention in the kidneys. leading to an elevated blood volume and thus causing higher preload. Increased preload is a compensatory mechanism that enhances the ability of myocardium to contract forcefully due to Frank-Starling mechanism. Up to a point, an increase in the preload or volume of the heart results in a greater force of contraction, but however, patients with heart failure often retain so much volume that at a certain point, only minimal benefit is obtained despite increasing preload. And due to the chronic increase in the ventricular wall tension, there will be hypertrophy of the cardiac muscle cells. In summary, the compensatory mechanisms results in increased heart rate contractility and increased preload and hypertrophy of the heart, and they ultimately lead to higher cardiac output. Unfortunately, these compensatory mechanisms, which serve to restore the cardiac output to your body tissues, also result in an increase in the workload of your heart and oxygen requirements and appear to cause remodeling. Progression and decompensation may occur when the primary disease plus the superimposed burdens of the compensatory mechanisms overwhelm the heart's pumping abilities. The clinical presentation of heart failure differs depending on which ventricle is failing to pump blood adequately. Left ventricular failure is the most common presentation of heart failure. Left ventricular failure often leads to right ventricular failure, and that condition is called biventricular failure. Please recall the anatomy of the heart. The oxygen-poor blood from your whole body drains into the heart via inferior vena cava and superior vena cava into the right atrium, and the blood moves to the right ventricle, and the right ventricle contracts and pumps the blood to the lungs where the blood gets oxygenated. The oxygenated blood comes back to the heart through the pulmonary vein and drains into left atrium. The blood in left atrium moves into the left ventricle when the mitral valve opens, and then the left ventricle fails, contracts, and pumps the blood through the aorta to your body. So when there is left-sided heart failure, the left ventricle becomes unable to pump blood into the aorta to your whole body. So the blood accumulates in your left atrium and ventricle, and then the blood backs up into your pulmonary veins and thus into the lungs. So the symptoms of left-sided heart failure include lower cardiac output through the aorta so that there will be lower perfusion to your peripheral tissues, and pulmonary congestion because the blood backs up through your pulmonary veins and then the lungs. Because of the lower cardiac output, you can see a decrease in the blood pressure. Reduced perfusion in kidney may lead to pre-renal failure and thus results in a decline in urine output, oliguria, with subsequent fluid retention. Also, inadequate perfusion of the brain may lead to altered level of consciousness, irritability, mental fatigue, confusion, and anxiety. And also because of inadequate perfusion of your whole body, you may encounter fatigue, activity intolerance, and lethargy. And because of the strain on the left ventricle, there will be hypertrophy in the long term. Backing up of blood into the lungs causes pulmonary congestion, and the symptoms include dyspnea or difficulty breathing may occur on exertion, which means with physical activity, and when the heart failure progresses, dyspnea may be seen even at rest. You may also see difficulty of breathing while lying down, and these are called autopnea and paroxysmal nocturnal dyspnea. When lying down, the heart accumulates more in your heart and lungs due to gravity, so it may help to use pillows to elevate your head. Paroxysmal nocturnal dyspnea also refers to intermittent attacks of severe difficulty breathing during the night, and it is very distressing for the patient. Sitting or standing may help relieve the symptoms of dyspnea because when standing or sitting, the blood pools in your extremities rather than your heart or lungs due to gravity. Cough is caused by bronchial irritation because of pulmonary congestion. In severe cases, there may be blood-tinged sputum because of the pulmonary congestion and from breakage of fragile pulmonaries. And the sputum may be frothy because of the fluid built up in the alveoli. Coarse crackles can be heard on auscultation by stethoscope, and these sounds are caused by the movement of air through the fluid-filled alveoli. And also because of pulmonary congestion, the alveoli in the lungs become partially fluid-filled and it causes hypoxia. And it interferes with gas exchange and thus may cause hypoxemia. Next, let's see the symptoms of right-sided heart failure. Because of the left heart and the right heart functions in series, the left ventricular failure eventually increases workload on the right ventricle. When there is pulmonary congestion, it becomes harder for right ventricle to pump blood to the lungs, and thus increases the workload on the right ventricle, and consequently it may lead to right ventricular failure. Isolated right ventricular heart failure is very rare and usually a consequence of right ventricular infarction or pulmonary disease, for example, pulmonary hypertension or pulmonary embolism. And when right ventricle becomes unable to pump blood effectively, the blood starts backing up into right atrium and also into superior vena cava, inferior vena cava, and thus into the systemic circulation, causing systemic congestion. So the blood builds up in your veins and vessels that carry blood from the body back to your heart, and thus increases pressure in the veins. The pressure pushes fluid out of the veins and into other tissues, thus causing fluid buildup in your legs called peripheral edema, and also in your abdomen causing ascites, which means swelling in the abdomen, and also to your pleural cavity, and it is called pleural effusion. Your jugular veins also become engorged, so you will see distended jugular veins. And the blood will accumulate in your liver, which is called hepatomegaly, and also because of increased portal pressure, you will see splenomegaly, which means enlargement of your spleen. Heart failure can develop suddenly or slowly. We can divide heart failure according to the time of onset into acute heart failure and chronic heart failure. Acute heart failure has a sudden onset. Acute heart failure can be indicated by the sudden appearance of new symptoms or a rapid worsening of existing symptoms of the heart. This condition can be life-threatening and thus requires immediate intervention. The most common cause of acute heart failure is a heart attack, which is also known as acute myocardial infarction or MI. It is caused by the blockage of arteries supplying blood to the heart muscle. In the chronic heart failure, the difficulty of pumping of the heart is ongoing and long-term, and chronic heart failure is more prevalent than acute heart failure. Actually, around 80% of acute heart failure cases are people with chronic heart failure whose symptoms rapidly become worse. In the chronic heart failure, the compensatory mechanisms are ongoing for a long time, and over time it is detrimental to your heart. Thus, the treatment of chronic heart failure is aimed at reducing the detrimental effects of compensatory mechanisms, thus reducing the workload of your heart. More accurate classification of heart failure type is made by measuring ejection fraction. Ejection fraction is a percentage of how much blood the left ventricle pumps out with each contraction. The normal range of ejection fraction is between 50 and 75%. The types are heart failure with reduced ejection fraction, which is also called HFrEF. HFrEF is associated with a left ventricular ejection fraction of less than 40%. Heart failure with preserved ejection fraction, HFpEF. HFpEF is associated with ejection fraction of more than 50%. HFpEF occurs when the left ventricle contracts normally during systole, but the ventricle is very stiff and does not relax normally during diastole, which impairs filling. Heart failure with mildly reduced ejection fraction is associated with an ejection fraction of 41% to 49%, which is between these two. This is the end of my video. The management and treatments of acute and chronic heart failure will be in the next video. If this video was helpful, please don't forget to give a like and subscribe to my channel. Thank you very much.